Well, we're going to move right into Charity. I see that she's got her screen up and the floor is yours.
Thank you. All right. Well, my name is Charity Rumger. I am at St. Joseph's Medical Center in Tacoma, Washington. We are a level 3 NICU, and we started a small baby unit about a year and a half to 2 years ago. We used to be a level 2 and became a level 3 about 3 to 4 years ago. I'm one of 5 nurses from our unit that's attending the collaborative, along with our educator, and as well as one of our APPs is going to the provider sessions. I've been a NICU nurse for about 2.5 years now. I love working with the babies, and even the complex ones. I like seeing them, watching them grow strong and be able to go home healthy. We chose our one thing to do by doing the NICU sweep. It started out as just a sort of impromptu group of 3 of us that went through the sweep shortly after we went to the first session and it was shared. We went through all of the different categories and listed out our different ideas for them. And when we looked at all of it, we decided that almost every category either needed the policy to be updated to address the small babies or it needed a policy altogether. So our small baby group decided that we would focus on the policies and try to lay the foundation. We hope as we go through the collaborative and address each of the different categories that we can then address the related policies and update them. So far, we've been focusing on the thermoregulation and skin. And for thermoregulation, we've been looking at the delivery room and golden hour. And for skin, we've been looking at improving our skin to skin in the first 3 days of life. For thermoregulation, at the same time that we started going to the collaborative, we also had a master's preparing student working with our unit and looking at thermoregulation to see how we could move the needle. Years ago, our unit had worked on the golden hour, but we were still having issues with cold and mid temperatures. As you can see from our VON data, we're group B. The black line is where the large group overall of VON is averaging, which is about 60%. The yellow line is where the VON small groups average, which is about 70%. And we met that goal in 2021, but when we started accepting 23 weekers, we dropped down to about 64%. So we wanted to improve there. Our master's student looked at our data, looked at what we've been doing, and decided to focus on creating our own normothermia fact sheet that we just recently completed and got printed and started distributing on the unit. It's a nice reminder, reference tool about the importance of thermoregulation. Also related to thermoregulation, we've been discussing about securing CPAP in the delivery room. So currently our labor and delivery is on the 14th floor and our NICU is on the 12th floor. So what we've been doing is with small babies is get them all in their box, but then somebody is usually holding CPAP in place with one of the portholes open while we come down to the NICU and then we put our CPAP in place. At the delivery session, I reached out to the group. I had a small baby admit where we did all the checklists. We checked all the boxes for the delivery room. The temperature was good, the bag, the thermal mattress, all those things. Baby was good in the delivery room, came down to the NICU and was cold. So reflecting on that scenario, the main thing that I could see was that we have the porthole open and we're having convection heat loss. So I brought it to the group, the collaborative group in the chat, and asked what others are doing for transport with their CPAP. And it seemed like the overwhelming answer was that most people are securing CPAP in the delivery room so you can have those portholes closed and keep the baby warm. So I brought that to our small baby group. Didn't get a whole lot of buy-in initially, brought it again to our process improvement team, and it worked out well. It was actually at the same time that our master's student was presenting on his thermoregulation. So I was able to bring it up again in the context of thermoregulation, was able to get buy-in. Our NICU leadership was there, and also our team manager was there. And they really liked the idea, and our team manager was able to take it to her team and present it to them. And it's gotten through some different variations. So right now the plan is we're going to secure CPAP using a RAM cannula so that it's less equipment, a little bit easier to set up in the delivery room, bring baby down, have all the portholes closed. Then in the NICU, we can put our full Fisher-Paykel in place. And then, so we're in the process. We have an RT that is putting together little kits with each of the different sizes of RAM cannulas to have on our transport isolate. And so I'm hoping very soon that we'll start seeing it implemented. We are also looking at our skin to skin. So our APP that is attending the provider sessions has a passion for early skin to skin. She's done it at other hospitals. Currently, our policy is that we delay skin to skin during that first 72 hours during the IVH bundle. But we want to change that and start implementing the skin to skin during that time. So we're going to have to update our policy, of course, to address that, but also we want to get a group together of both our RNs, our RTs, and our physical therapists and work through the mechanics and logistics of how we're going to do that, how we're going to move baby with all the different various types of respiratory support, and then bring that to our staff with some staff education. So we have a plan in place. So we're working on that, helping to move forward. But also at the same time, we're trying to encourage more skin to skin. So we did our very first Kangaroo-a-thon in May. Our parent advocate organized a 24-hour Kangaroo-a-thon. She invited families to participate. She also arranged for volunteers to come in and do some holding as well. And they logged and monitored how many minutes were held during that time. And so for our very first Kangaroo-a-thon, we had a total of 2,994 minutes of holding. So we're very happy with that. And we're hoping to next year probably expand it to more like a week-long Kangaroo-a-thon as well. For team engagement, we've been working with the whole team. Thankfully, our nursing leadership is very engaged. They participate in our small baby meetings as well as our process improvement. We have a provider who's participating in the provider sessions and is also helping to get that team involved. And then we're working with our nurses, RTs as well. So we're trying to get everybody as well as the family involved. We just recently started a unit practice council. So as we move forward with these different projects, I'm sure we'll be bringing it to them as well and bringing them in. We've been very thankful for all the tools that have been shared. We've, like somebody else mentioned, we're also collecting them and saving them up to be able to use later as well. But the main one that we've been distributing right now is from last month, that sepsis tool. We found it very helpful. I found it very helpful with the layout and the very graphic and helpful information on there. So several times as I've taken care of babies, I've pulled it out and shared it either at shift report or with precepted. It's just things to look at. Are any of these things changing with this baby that we need to be concerned about? So we've made that available on the unit for people to use. And then what we've been doing as far as our documents is the thermoregulation flyer. We're in the process of updating our policies and procedures. We don't have any of them done yet. We've also, by word of mouth, been spreading and sharing about doing the duoderm with the temp probes. I've used it on several of my babies and the heart sticks really well to the duoderm, have had less problems with the temp probe coming loose. So it's just been being spread around the unit and hopefully we'll see more buy-in on that. And then we've also updated our admissions checklist. It's based off of our previous one. Our previous one had been copied so many times that the quality has gotten poor and it also needed some other updates. So I went through and tried and group it and make it a little bit more user-friendly with clear areas to write information down. With both the pre and the post briefs as well. And then on the back side of it, we've added an admission setup list of what equipment that we want to have in our typical admission room. It covers both of our big babies as well as our small babies so that we can be consistent on what equipment is there and ready at the bedside. We recently brought this to our unit practice council as well. So we're going to do a few more updates. I'm going to add to the back the weights of some of our equipment, like the hat and the bags and that kind of thing. So it's a quick reference for if we need to subtract anything when we're doing that initial weight. For successes and wins, we're still in the continual process of making these changes and getting buy-in, but we are getting close to implementing that CPAP being secured in the delivery room. And we also had a very successful, I think, first Kangaroo-a-thon. For lessons learned, definitely don't give up to coming to more than one meeting and presenting the idea to get buy-in on the CPAP. And then we really have appreciated all the tools and resources that have been shared. And I wanted to share one that I had put together for our unit. It's based off of our policies and procedures, but it's just a quick reference tool that I like to carry around. So if I'm admit nurse or if I'm charged or if I'm taking care of a small baby, I can look up real quickly, okay, do we do humidity? Do we do Vaseline or do we do zinc? All those different little things based on their gestational age and their weight. So it's a quick reference tool. So I just wanted to share it as an idea for others. This is based off our policies, so yours might be slightly different, but it might be something helpful if you don't already have something for your team. And with that, I'll just turn over for questions.
Fantastic. Thank you so much. That was really great. People are definitely loving that last couple documents that you're sharing, and thanks just for those lessons learned. That was fantastic. So awesome. Everyone's saying they love your documents. Way to go. You have lots of team members involved that are really creative. That's amazing. Yeah, that last one looked really great. Fantastic.